There has been a concerted effort over the years by anti-gunners to paint guns as a public health issue. Nearly 20 years ago, then Director of the CDC, Dr. Mark Rosenberg, tried to label guns as a public health issue, saying, "We need to do for guns what we did for tobacco, to create a public perception of firearms as dirty, deadly, and banned." Now, since then, despite the number of legally owned guns doubling and the murder and violent crime rates being cut in half, they continue to follow this roadmap. Just last year, former New York City Mayor Michael Bloomberg gave nearly $500 million to Johns Hopkins Bloomberg School of Public Health to fund anti-gun research. Now that's $500 million with a B. They've already churned out several studies with ridiculous methodology and conclusions that are absolutely insupportable by official statistics. And now we have the appointment of Dr. Vivek Murthy, who has a clear history of anti-gun activism, to the position of Surgeon General, where he'll set public health policy. But are guns a public health hazard? Let's put aside the hyperbole and examine the numbers. According to the CDC, 11,000 people are murdered with firearms each year. Now that sounds like a big number, but let's put it in perspective. 2.5 million Americans die each year. 2.5 million. That's a rate of 799 per 100,000 people, compared to 3.6 per 100,000 for firearm homicides. This means that firearm murders account for 0.4% of deaths, less than 0.5% of the deaths in this country. Compare that to the top 5 actual public health issues: heart disease, cancer, respiratory disease, stroke, and accidents, which individually cause as much as 50 times more deaths. Now, I tried to determine where homicide by firearm ranked as a cause of death, but it didn't even make the CDC lists. So it gets pretty ridiculous to claim that something that accounts for less than 0.5% of deaths is a public health hazard. So how do they get away with it? Well, they do it primarily by making emotional arguments, or emphasizing large-sounding numbers without perspective or context. In order to do this, they often lump in suicides by firearms. You see, suicides account for 1.6% of deaths, and about half of suicides in the U.S. are by firearm. Of course, this makes sense considering that the latest polls put firearms in just less than 1/2 of American homes. But that means that there are twice as many suicides by firearm as there are murders by firearm. And they can use these numbers to report the total number of gun deaths at just over 1%. Now, the dishonesty of this comes when we consider that according to the CDC, the National Academy of Sciences, and frankly, every other non-biased source that has studied it, that suicides and murder rates do not change with the number of legally owned guns in an area or with the implementation of gun control laws. In other words, if we banned guns, we would still have the same number of murders and suicides. This isn't a gun issue, but a violence and mental health issue. And since they want to paint gun ownership like smoking, let's compare guns to smoking. According to the CDC, smoking caused 480,000 deaths per year. 16 times more deaths than all firearm deaths combined. Despite these facts, the anti-gunners will continue their attempt to garner support for gun control by falsely painting guns as a public health hazard, and we must fight this on every front. The appointment of 36-year-old Obama organizer Dr. Vivek Murthy to the role of Surgeon General is a clear attempt to further the lie of guns as a public health hazard. Write to your senators today and urge them to oppose his confirmation.